What's up, everybody? My name's Eli, and welcome back to my YouTube channel. If you're new to the channel, I'm a fourth-year dental student at Boston University Goldman School of Dental Medicine, and on this channel, I make videos of my dental school journey, as well as videos with advice to pre-dental students on how to get into dental school. As promised, more recently, as I'm approaching graduation, only 3 months away, I've been looking to make more videos that can help people who aren't necessarily interested in going to dental school. Not too long ago, I made a video about why content creators are important in the medical and dental field, and one of the reasons that I find us to be extremely important is because we are some of people's main source of information. Everyone doesn't have equal access to healthcare, and as a result, they may not get the information that they need by going to the doctor every year or going to the dentist every 6 months. So this is where they get their information. In order to help bridge that gap, I want to start making more videos like this to help people get the information that they need. The last video I made, which was the perfect oral hygiene routine, advice from a dentist, seems to be doing very well. So I know people are enjoying these videos, and I'm going to keep making them as long as I see you all are enjoying them. Before I get into this video, please make sure you subscribe to the channel if you haven't, like the video, comment under the video, share the video with whoever might find it interesting, etc. By supporting the channel, you are indirectly helping people go to dental school through my scholarship, the Student Dr. Eli Pre-Dental Scholarship. Now let's get into the video. In today's video, I will be answering 10 frequently asked oral hygiene questions. Before I get into the video, let's just start with some basic information. You are supposed to brush your teeth twice a day, you are supposed to floss at least once a day, and you are supposed to see your dentist at least every 6 months for a checkup. Now that we got that basic information out of the way, let's get into the content of the video. So a lot of these questions really aren't common sense. Some of these things I didn't know before I started dental school, and they're pretty important things to know. Realistically, you won't get answers to these questions unless you directly ask your dentist or do your own research because you're just curious. Not knowing this information won't be detrimental to your oral health, but knowing it can be very beneficial in helping you correct some mistakes that you may be making in your day-to-day life. So the first question is, should you brush before or after breakfast? I've spoken on this topic before, and I'd like to mention that although I'm going to present to you the educational correct answers, there are some opinions that I have that you may agree with that you may find helpful. So, you should be brushing your teeth before breakfast. When you wake up in the morning, you have dry mouth, you have bacteria that's multiplied overnight, and eating as soon as you wake up without brushing your teeth can help this grow and grow. I know some of us don't want to have our breakfast tasting like toothpaste in the morning, but I promise you that's not going to happen. Some ways you can help with this are waiting a little bit after you brush your teeth in the morning or drinking some water after you brush your teeth before you actually get around to eating. But yes, technically, you should be brushing your teeth before breakfast. Now, if this kills you and you just can't wait, here is my #1 advice. If you're going to eat breakfast before brushing your teeth in the morning, please, please, please wait 30 minutes after eating before you brush your teeth. I talked about this in my other video, things that I would never do as a dentist, and you can check this out. But basically, you don't want to be brushing your teeth while you're having an acid attack. Now, moving on. Question number 2. Should you floss before or after you brush your teeth? Now, the general consensus on this question has been it doesn't matter. The reason I say it doesn't matter is because so little of the population flosses every day that what we need to be focusing on more as a group, as a collective, as a unit is just making sure we are flossing every day and not getting into the nuances of whether we do it before or after brushing. Now, there are arguments for both sides. I mean, some people, like myself, I like to floss before I brush so I could dislodge any food particles, etc. And it'll allow me to get cleaner when I brush with a toothbrush and toothpaste, because the toothpaste and the fluoride and everything else can actually reach in between my teeth when the food isn't stuck in there. Other people like to floss after they brush because they figure that they can remove all the particles when they brush, and then when you floss, that can help you spread the fluoride in between your teeth. So honestly, it could go either way. But the main thing is making sure you are flossing at least once a day. Number 3, what is the best toothpaste? It doesn't matter. They're all the same. No, seriously. Like, they're all the same. You know, when you go to the store and you're shopping between Tylenol and the store brand acetaminophen, it is the same. Literally, it will be acetaminophen 400 milligrams or acetaminophen 400 milligrams. One just has a brand name of Tylenol, and they charge you $3 more for that. Same thing applies with toothpaste. If it has fluoride, it's good for you. If you're anti-fluoride, look for nanohydroxyapatite. that is almost as strong as fluoride and has the same benefits of protecting your enamel. Crest, Colgate, etc. doesn't matter. When it gets down to that, it's really up to you based on taste or abrasiveness, how you may feel. One thing I was shocked to learn during my first year of dental school is that technically Crest Pro Health is not a great toothpaste because it's so abrasive. Before I started dental school, Crest Pro Health was my favorite toothpaste. I'm not gonna lie, this is the truth. Now, personally, I use Crest 3D White. So if you're just looking for a toothpaste that's like the one I use, maybe you like that I have pretty nice teeth or whatever it might be, Crest 3D White. You know it's trash, like on the low it's actually trash, charcoal toothpaste. You're wasting your money. I'm sorry, it's not gonna help your teeth get whiter. Anyway, leading into our next question. Question number 4. What is the best way to whiten your teeth? Now, did you know that the only ADA approved whitening strips are the Crest 3D whitening strips? I've used them one time in my life. That's it. I just brush my teeth and go. But I will say, when I got my braces off the second time, I was like, I'm gonna try everything to make my teeth whiter. I just paid for these braces a second time. I think I might want to go to dental school now. So what should I do? You know what I bought? I bought charcoal toothpaste and Crest 3D whitening strips, and I used it every day for like 2 weeks. And you know what? I will say, I think it might have made a difference. I'm not gonna lie. You know what? I've been thinking about making a YouTube video on how to whiten your teeth at home the best way, and I will repeat what I was doing with the charcoal toothpaste and the Crest 3D whitening strips, and we can do a little video on that. What do y'all think? Leave a comment down below if you want to see something like that. Okay, next frequently asked question, number 5. For all my mothers and fathers out there, when should I take my child to the dentist? And the answer is when you first see teeth coming in or by the age of 1. One or the other. But as soon as you see those teeth come in, which are likely going to be these 2 small ones in the front, take them for that first dentist visit. You want your child to get accustomed to the dentist so that they don't grow up with a fear of dentists. Because unfortunately, from what I've seen in my short career span, that fear does not go away. Question number 6. Do you have to shave your teeth down for veneers? Yes. I don't want to hear about no prep veneers. They're trash. I don't want to hear it. For good veneers, you do have to shave your teeth down a little bit. People can get composite veneers now. I'm not saying that, composite veneers aren't a thing. However, no prep veneers, no prep, you're just slapping composite on it. Trash. Next frequently asked question. Do you have to use mouthwash? I guess technically no, but you really should. Whether it's a fluoride rinse or an antibacterial rinse, you should be using mouthwash as part of your daily oral hygiene routine. If you want more oral hygiene tips, definitely check out the video I just made a couple days ago. Question number 9. When should I take my child to the orthodontist? Well, your general dentist will let you know when you take your child to the dentist starting from age 1. It all depends on how your child is growing, getting adult teeth, losing baby teeth, etc. These all play factors into orthodontics. When I was growing up, like literally when I was a kid and a teenager, the rumor used to just be, oh, you can't get braces until you have all your adult teeth. That's not true. There are things like early orthodontics that are for kids whose faces are growing rapidly at different rates. Say like your maxilla, which is the top jaw, is growing way faster than your bottom jaw, and you're getting that overbite. You can do interceptive orthodontics early in age, like 7, 8 years old. Even now, as I learned about that in dental school, I realized in my elementary school class, there was one girl that got braces at like 8 years old. And we were all like, yo, like, how'd you get braces already? You know me, when I was 8, my older sister was 13. So she was like just getting braces. And I was like, yo, that's so cool. Like my sister just got braces, but she has all her adult teeth. How'd you get braces already? And if y'all saw my teeth when I was a kid, we knew I was gonna need braces. I couldn't wait to get them things. I knew I needed it. Listen, y'all gonna have to take my word for it. It was bad. Question number 10. Very frequently asked question, sometimes considered a hot topic because this is something that people really don't know. Should you rinse your mouth out after you brush your teeth? No, technically you shouldn't. Your toothpaste has fluoride or hydroxyapatite that is put in it and meant to help build your enamel. So leaving it on your teeth after you brush is what's doing the building and the remineralizing. Rinsing out with water is washing all of that out. So no, technically you should not be rinsing right after you brush your teeth. So that's it, everybody. That's me answering 10 frequently asked oral hygiene questions. I hope you enjoyed this video. got some of your questions answered. If you have more questions, leave a comment down below and you'll get your questions answered there. I always respond to comments. Check out some of my other videos while you're here. I'll leave them in the end screen after this video, and I hope you guys enjoyed this one. See you in the next one. Peace.